Hi, everybody. So I just finished the general survey of Mr. Bear, and now I'm going to move forward with the head, neck, and face assessment of my patient. When I'm going to position myself in front of the patient. I'm going to be looking at their skin, making sure that there's no kind of lesions or skin breakdown, any dryness, overly red, irritation, edema, um, signs of trauma, any active bleeding. I'm also looking at their eyes, their ears, their nose, symmetry of the trachea, just making sure that everything looks normal, at least just from an inspection standpoint, from a visual standpoint, rather. Um, Ask the patient if they're experiencing any pain, if they've had any history of trauma on their face, give me any indication of something that I'll find before I'm even started looking for it. And since I'm in front of the patient, I will be assessing cranial nerve 7, the facial nerve. I'll ask them to smile, frown, and puff out their cheeks. And they do that with ease, so that tells me that that cranial nerve is intact and it's working properly. And then from this point, I'll move forward with the with palpation, and I'll be checking the hair and the formation of the skull. I would perform hand hygiene, don gloves. I would be checking the skull for any kind of indentations, any deformities, signs of trauma, swelling. I would be checking the hair for any kind of infiltration, any mites or lice. I would be checking the scalp, the skin on the scalp, making sure that all of that's intact, that there's no bleeding, no signs of trauma, not overly dry, good color. So I found that my patient has good circulation, that his skin's intact, his cranial nerve 7's operating and functioning normally. He has symmetry in his ears, his nose, his trachea, not his eyes, unfortunately. I don't know if you can see that. I would then ask, is that something you've lived with your whole life? He would say yes. And from that point, I'd move forward. While you're palpating the patient's face, you're going to be wanting to check the temporal mandibular joint, TMJ. You want to hold bilaterally on both sides. It's hard to do on this anyway, but and have them open their mouth. You're going to want to feel for any kind of swelling. Ask if there's any associated pain. You're going to want to feel for any kind of clicking, which can also be a sign of something abnormal. TMJ abnormalities are not uncommon. I know my jaw clicks sometimes actually, but I found no problems on my patient related to his TMJ. So we're then going to start inspecting the patient's eyes, and you're going to again want to be checking for any kind of lesions, any kind of redness, swelling, lacrimal duct activation, any kind of overly teary signs of irritation, discharge. Ask the patient if they're experiencing any kind of pain related to their eyes. They say no, everything appears normal. You can move forward. We're going to now test cranial nerve 3, 4, and 6, and we're going to start with making sure that there's no kind of abnormal shaking with their vision, and we're going to do that by using our pen light, and we're going to start, it'll be better like this. We're going to start about 2 inches from their eyes, and we're going to ask them to focus on the pen and follow the pen out. We're going to go about 12 to 14 inches out slowly and then go all the way back. And you're going to be focusing on their eyes and making sure that you don't see any kind of abnormal shakiness or anything. Next, we're going to see how reactive the pupils are to light. And we're going to do this by having the patient, you could dim the lights a little bit so it's easier for the patient to focus. You will have them stare at something out not too far in the distance. So I'll have the patient stare at that plant right there, which isn't too far. You guys can't see it. Then we're going to use our pen light to test their pupils' reaction to light bilaterally. So we're going to have them stare at the plant, in this case. You're going to come from the side, and you're going to be watching for pupil. You're going to make sure that they're dilated prior to shining the light. And you're going to bring the light slowly across to the left eye and make sure that the pupil reacts on both sides. So you're going to do this bilaterally. You're going to make sure that no matter which side you're on, both pupils are reacting to the light equally, and luckily on my patient, they are. And now, after doing our assessments using the acronym PERLA, pupil, equal, round, reactive to light, and accommodate, we can document that all of our findings are normal at this point. At this point, we've assessed PERLA with our patient, everything's normal. While checking the TMJ, we also checked for lymph nodes, making sure there's no swelling and no pain associated with that area on the patient. We're now moving forward to the mouth and pharynx. So we're going to have the patient, we're going to make sure that the lips, teeth, gums, buccal mucosa, everything looks normal, normal color, no pain, no signs of canker sores, any kind of lacerations, bleeding, anything, any pain associated with that area of the patient. We're going to be assessing cranial nerve 9 and 10 at this point, and we're going to do that by having them open their mouth and saying "ah," and making sure when we look in there, and you'll be using the pen light. So go ahead, Mr. Bear, open your mouth and say "ah." He complies, and I see the uvula rise and fall, and he responds and says "ah." So we've assessed the glossopharyngeal and the vagus nerve at that point. Everything's normal. We're going to then move forward with the hypoglossal. While they're doing that, since they're sticking out their tongue, I'm going to have that, which is cranial nerve 12. I'm going to have them stick their tongue out and then move it side to side. Mr. Bear does that, so all three of those nerves are working properly. At this point, I can document everything that I have found so far, that there's no abnormalities with the mouth and pharynx. Everything's normal. Those three nerves are working properly. I can move on to the neck, assessing the neck area of the patient, anterior and posterior, making sure that the appearance is normal, the skin, no signs of edema or trauma, any bruising, any kind of abnormal masses on the neck. I would ask Mr. Bear, is there any pain when I press here lightly? Have you had any issues? He responds, no, everything's been normal. I'm going to have him tilt his head to the left, to the right, turn left and right. I'm doing it, he's supposed to be doing it, but everything appears normal, functional. I document that. Head and face, I'm going to palpate the head and the face. I'm going to make sure both the front and anterior and posterior, making sure that the sinuses work in the nose. I can do that by occluding one side, having him inhale, do that bilaterally. If there's any kind of obstruction in the airway, nothing, everything appears normal on the patient. You make sure, and they don't emphasize this enough, that documenting everything as you go, just so you don't miss anything. I'm sure this becomes natural as we get further into our career, but right now I'm going to have to document as I go. You're always checking for pain, ears, nose, eyes, head, neck, everything appears normal. The cranial nerves I assessed are functioning normally. I found no abnormalities. So at this point, I'm going to assess the neck, the trachea, the carotid arteries, and I'm going to do that by auscultation, making sure to use the bell of my stethoscope, not the diaphragm. And when I'm doing this, making sure not to apply too much pressure, listening for bruits, also palpating and feeling everything individually, making sure there's nothing abnormal. Checking the thyroid, again, assessing the lymph nodes. Everything sounds and appears normal. While I'm here, I'm also assessing the trachea, making sure that it shifts properly and that we have good tracheal shift. From that point, I've documented everything that I've found. I have found no abnormalities besides the lack of symmetry with the eyes on Mr. Bear, no pain, nothing abnormal to note of. Overall, a good assessment. Thank you.